Tachi was named a Knight Commander of the British Empire in 2007 for his medical research in Britain. He is now receiving the Seattle BioMed's 2011 Advancing Global Health Award for his work in alleviating the suffering of many millions worldwide. So although this is a smaller organization than the one that knighted him, it is for a far more reaching endeavor. So please join me in congratulating Tachi Yamada. So I think we're going to give you the award maybe later. Okay.
Thank you, Ken. And thank you all for attending this wonderful occasion on behalf of Seattle BioMed. I know there's more to be said later, Ken, but my heartiest congratulations to you for your enormous accomplishments here at Seattle BioMed over these past 35 years. As I look across this room, I realize that many of you are not of the global health community that we usually speak to. And so I'm going to try to give you some sense of what it's been like to work in this community and the accomplishments that I think we've been able to experience as well. Seattle BioMed, and the community of scientists have had a huge impact on health in the United States and everywhere in the world. Some of you are aware of the accomplishments of the scientists, many of whom have added greatly to this community. But as you may also be aware, more than half the world has no access to these advances that we benefit from every day. This is a great inequity. And we think about it as a problem that's out there somewhere, a problem that maybe is not so important for us. But very quickly one realizes that these great disparities between rich and poor, between the haves and have-nots, between the developed and the developing world, is not just a matter of passing interest of a problem that exists for others and not ourselves. We think about SARS, a viral infection that started somewhere in China, rapidly moved to Canada and Singapore, two very wealthy nations, and threatened to destroy the economy of those nations until this virus gradually and quickly disappeared. Or take the instance of a young physician, a young lawyer who, on his honeymoon, decided to go to Europe. And at some point during his honeymoon, somebody discovered that he might have a drug-resistant tuberculosis. And then it just about shut down the airline industry as people started to look to see who else might be traveling on planes that would have drug-resistant tuberculosis. Or take this H1N1 epidemic that we experienced just a little over 12 months ago, where the world was uncertain as to whether hundreds of millions, billions, or just tens of thousands would die from this infection. And we were ill prepared to deal with it. So these issues that seem far away from us are matters of national security here, as well as matters of great consequence in the poor nations of the world. And what's really sad about these things that happen today is that they have lasting consequences. There's evidence that if you are malnourished in the first 2 years of life, you will have lower intelligence, lower earning power, higher incidence of obesity, diabetes, heart disease, greater number of strokes, even cancer. So these things that happen today will be problems that we'll be continuing to face each year that we live our lives. And if you talk to any company in Seattle or any company, multinational company, anywhere in the world, and you ask them, where is your future? There's not a single one that won't say, in the emerging markets. That's where the future of industry lies. So the very place where our economy will grow is the place where there are great inequities that we have to address and somehow come to grips with. Well, the Bill and Melinda Gates Foundation, you probably know, was established really in its current form only about 10 years ago. And I'm glad to see Bill Sr. in the audience today. I'm always told that he used to write checks in his garage or office next to his garage for many, many opportunities. But the first really big check went out to the Global Alliance for Vaccines and Immunizations, and I'll talk more about that organization, literally only 10 years ago. And the foundation reflects the bias of the people who created the foundation, Bill and Melinda, that technology-based health solutions are the most cost-effective solutions of all. That if you take the example of polio and look back into the 1940s, late 30s and 40s, when this country was trying to deal with the problem, there was at that time the March of Dimes. The March of Dimes was an organization in part facilitated by Franklin Delano Roosevelt, the president, because he himself suffered from polio. And this organization had choices to make. And the choices it could make was to pay more for the treatment of people who had polio, many of whom were lying in hospitals in iron lungs, unable to breathe without these instruments, or to invest in research. And that organization chose to invest in research. And today, the fruits of that research is a vaccine that costs about 12 cents per dose when the United Nations buys the vaccine. And it has created a world in which we are almost polio-free. So the foundation invests in technology-based health solutions with the aim of delivering them for impact. Now, what has the foundation accomplished in its 10 years? I really would like to focus on what I think the advances have been in the last 5 years, the time that I've been associated with the foundation. The first and most important accomplishment of the foundation was to create a sense of urgency. Urgency. It seems crazy that we would have to have a sense of urgency when you consider that 8 million children are dying each year unnecessarily from diseases that could be treated or prevented. It's hard to believe. Anyone who's experienced the loss of a child or has known a family or a friend that lost a child knows exactly how devastating that loss can be. It can affect a whole community. This is happening 8 million times each year. And the families who lose those children suffer those losses no less severely than the friends that you know may have lost a child. So why is it that we haven't had this sense of urgency about this problem? I think part of it was that we didn't have enough money to do anything about it. There was a sense of futility. So we would do small demonstration projects and show that if we did, under controlled circumstances in these 3 villages, the 5 things that we thought were important to do, we'd actually show that these things worked, and we'd write a paper about it, and then we go home and forget about it. Because there was no means to take these advances and make them more broadly applicable to broader group of people, to disseminate the knowledge, to ensure that the things that worked could be delivered to the people who needed them. Now, the world has changed since then. In just the past 10 years, the amount of money available for issues and problems in global health has gone from about $6 billion per year to $25 billion per year. If you think back 10 years ago, it looked like the nations in Africa were going to go away because HIV was just exploding, and there was nothing to do about it. There was no way to deliver medicines to those people suffering from HIV. That has changed. We now have the President's Emergency Program for AIDS relief. We have the global funds to fight AIDS, TB, and malaria. There are huge amounts of money available. Now what we have is a challenge to make sure that that money is being used efficiently and effectively. I do think that we actually have the ability to think big, to take great risks, to talk about the eradication of polio, to talk about the eradication of malaria. In 2007, Bill and Melinda were part of a group that hosted a malaria forum here in this city, and they put out a challenge to eradicate malaria. And I can remember well groups of people that came up to me afterwards and said, "Everybody knows you can't eradicate malaria. Why do you raise hope?" I said, "Why is it that we can't eradicate malaria?" And they said, "Because there have been people that have done mathematical models dating back to the 1950s to prove you couldn't eradicate malaria." And my response was, let's fund new modelers to create models that will prove that we can eradicate malaria. In fact, if we are not ambitious, we will not accomplish anything. I can tell you that today was a wonderful, important day for the world. You may have read that the Global Alliance for Vaccines and Immunizations has raised $4.3 billion for vaccines in the world. This follows on the news last week that some of you may have read, where the vaccine manufacturers of the world have reduced the price of vaccines for the poorest of the poor by as much as 2/3. So if you take the amount of money that's now available for vaccines and the amount of reduction in vaccine pricing, we are now about tenfold better than we were just 1 year ago. 1 year ago, I can remember us presenting to Bill Gates the status of affairs of the Global Alliance for Vaccines and Immunizations. They had stopped accepting applications for new vaccine introduction for rotavirus and pneumonia. It looked like Gavi was going to run out of money, and there was a great sense of sadness in the room. And Bill said, "So we're down to a triage plan. We're going to have to decide who's going to live and who's going to die because we don't have enough money to provide the vaccines for these children." That created a sense of urgency in all of us. we weren't willing to accept it. And just 1 year later, with a 2/3 reduction in the price of vaccines and a tripling of the amount of money available for vaccines, we think we can provide every child in the poorest countries of the world with the essential vaccines, the pentavalent vaccine, the rotavirus vaccine, and the pneumococcus vaccine, and we now have enough money to guarantee that we can deliver this. That is why we have a sense of urgency. I think the second thing that the Gates Foundation has done in the past 5 years is really created a focus on innovation. Now, innovation is a word that everybody uses. It's cool to talk about innovation. Every company has innovation in its logo somewhere. But innovation is something that's really not well understood by most people. Because innovation falls into two categories. There's a category that's necessary. It's called evolutionary innovation. We make a better widget now, one that works better. But there's also a category of innovation called revolutionary innovation, where we really rethink how things are done. You know, I always hate to admit it, my wife's in this room. We've been married 44 years, but 1 year, and those wives in the audience will excuse me, I gave her a microwave oven for Mother's Day. I'll never hear the end of it, but... And why? Why was it? Because it just fascinated me that you could boil water without heating it. That you can make molecules collide with each other. And that created enough friction that the water boiled. I have since given her better Mother's Day presents, but I will say that instrument has become very important, probably one of the most important instruments in our kitchen as a result. But here was revolutionary innovation. Heating water without heat. That is really important. And it's that kind of revolutionary innovation that global health needs. Why don't we have a malaria vaccine? Why don't we have an HIV vaccine? Why don't we have a TB vaccine? Why? Because we need innovation. We need out-of-the-box thinking. We need thinking that challenges dogma, because dogma has kept us in the dark with these three important vaccine needs for three important diseases. After all these years, with all these successes in many other vaccines, there's so much we don't know about TB, HIV, and malaria that we don't have a vaccine. So we created a program called Grand Challenges Explorations. And this was a great program. Basically, all you had to have is an idea and a way to test it, and a 2-page application. No preliminary data required. To get $100,000 from us, and if the idea succeeded, then we would give you $1 million for the next phase of the research. Sort of a phased venture investment, if you will, in innovative ideas. The most important aspect of this is that there was no peer review. We only used innovators as reviewers, people who didn't know anything about the topic other than to be able to recognize creativity, innovation. Because, of course, we always knew that innovators have no peers. And if you subject innovators to peer review, then you will kill the innovation. And that's what we wanted to avoid. So we looked at, let's take an example, malaria. In malaria, you know, there's been some great innovation. Sumitomo Chemical Company figured out a way to impregnate polyethylene fibers with insecticide. And this insecticide would leach off of this fiber slowly over time. So you could create a bed net that would leach an insecticide for 5 years. It was a fantastic innovation. More than anything, this one innovation has probably resulted in the fact that 11 countries in sub-Saharan Africa have decreased their incidence of malaria by 50% or more in the past 5 years. But what are the next steps? What are the innovative steps that we're going to be looking at? And we've looked at really exciting ideas. One of them, for example, a vaccine which actually will vaccinate the human so that the antibodies will work against the mosquito and prevent the mosquito from participating in the life cycle of the malaria parasite. Or how about an approach involving what's called a homing endonuclease gene that will insert a gene that will ensure that the mosquito species involved in malaria transmission will eventually die out quickly over as short as 15 generations if introduced into the right population. Or the one that I always like to tell is the story of taking two telephone poles into a community and putting an electrical field between them and allowing it to detect when a mosquito crosses that field and differentiating that mosquito from a fly or a bird or another insect, and then linking that field to a laser that then would zap the mosquito and kill it. The man whose idea this was created the Star Wars program for the United States. You should know about this. The point is, it's important to think outside the box. Crazy is close to being good. In fact, if you're not close to crazy, it's probably not innovative enough. And we should be thinking crazy in order to come up with new ideas. And by the way, this doesn't have to be limited to science. It can be in other areas. For example, in financing, we've created different mechanisms. For example, using the foundation's balance sheet as a financial tool to create opportunities to reduce pricing of vaccines. We've developed mechanisms of implementation of interventions which are very creative, such as the Affordable Medicines Facility for Malaria, which provides a subsidy to wholesalers which would guarantee that retailers would actually provide the right medicine for people who come to them. One of the most difficult things to understand in global health is that as poor as nations are, many nations in the poorest countries, and many of the poorest countries in the world have the vast majority of health care provided in the private sector. 75% of all health care in India, for example, is paid for out of pocket by citizens in the private health care system, not provided by the government. And the first place they go to for medicines is not the hospital, not the government facility, but the private vendor that comes into their town with medicines. And how do we ensure that the right medicine gets prescribed? Provided to the patient? And that is with an incentive, and the incentive ensures that they profit more if they give the right medicine. And so this kind of innovation delivery is very important. The third area where I think the foundation has made a significant impact is in the area of measurement. And some of you in the audience work for the foundation. They're really tired of me telling this story and repeating these words. But I used to work for somebody who was a Wimbledon tennis player, a champion tennis player. He was a CEO in a pharmaceutical company where I worked. And he used to say, if you aren't keeping score, you're just practicing. And in global health, we can't afford to be practicing. We have to be keeping score. There's not enough money to waste. The money we use has to be making points. So we actually have spent a lot of money in trying to actually get data so that we could keep score. We've invested in the Institute for Health Metrics and Evaluation, a very important Seattle institute set up at the University of Washington under Chris Murray. We've invested in the Health Metrics Network. We've invested in the International Initiative for Impact Evaluation. We've invested in the in-depth network. It's a surveillance network. We need data. Without data, we don't know whether the investments we're making are paying off or whether they're just a waste of time. We need to course correct. Like any business, we have to know when to fish and when to cut bait, and we can't do that without measuring. In fact, one of the most important elements of this is an ecosystem in which data sharing is commonplace and is the accepted practice. Sadly, in medicine and medical research, people have a tendency to withhold data, to hide data. For what? It's hard to understand. Sometimes it's for fame, sometimes it's for profit, sometimes it's just because people are ornery. But the fact is, there's important information, and those people that are withholding the data are keeping that information from saving lives. So one of the things that we have really advocated for and worked with the H8, a group of agencies that are involved in global health, is to ensure that all health data is provided openly, that there be every effort to have common data architecture, and that we be dedicated to the principle of multiple reviews of the same data set so that we can be sure that the most information can be obtained from whatever it is that we have. Finally, I think one of the areas where we have worked really hard to make progress is in the area of partnership. We've always known that we couldn't do it alone. But you know, the landscape was not good in global health, where the WHO was going in one direction and the USAID was going in another direction and UNICEF was doing something else, and there was very little communication between them and very little partnership between them. We have worked very hard to make sure that there would be alignment and partnership in almost everything that we did. And I think the best example of success in this area was related in an event that I attended just about 6 months ago in Ouagadougou in Burkina Faso. Now, the fact is that meningitis A is a horrible illness. I don't know if any of you have experienced it. I remember once when I was an intern in the emergency room, I saw a young mother come in, and she was talking to me, and within minutes of my starting the conversation with her, she deteriorated and went into seizures, and before I knew it, she was almost dead. This is meningitis. She had so many of these bacteria in her circulation that you could just see it on a peripheral smear of her blood. This is a horrible disease because it kills so fast. And even those who survive have lasting consequences. 10 years ago, the health ministers of the countries who suffer from this illness decided they wanted to do something about it. A very important collaboration was established between the WHO, who wanted to help these health ministers, the FDA and the NIH that held very important intellectual property, PATH, an organization all of you know in the Seattle area, the Serum Institute of India, and the Gates Foundation. And the idea here was that we needed a vaccine, but it had to be not just any old vaccine. It had to be highly effective. It had to be effective for a significant period of time, and it had to cost less than 50 cents. Now, that seemed like an impossible task, but over the period of 10 years, it was successful. And I was able to give a 7-year-old girl in Ouagadougou a vaccination. Now, I can tell you, I have not given a vaccine to a child in more than 20 years, and I was a little bit scared about giving her this thing. But I gave her the vaccination. Happily, she did not cry, and she just had a huge smile on her face. And I thought to myself, that's why I came to the Gates Foundation. That's the promise that we would invest in a technology, that we would be able to deliver it to spec, that we would be able to have children benefit from it and leave with a smile on their face. Bill Gates gave a graduation address at Harvard University when he finally obtained his degree a couple of years ago. And he said something very profound and important. He said that humanity's greatest advances are not in its discoveries, but in how those discoveries are applied to reduce inequity. I've witnessed for myself this problem of inequity. It's not a game, it's not different. It's very different from anything I've experienced in academia or in industry. The battle against death and misery is stark and real. But we can win this battle. We have so many examples of it. Great advances are in the offing. Seattle BioMed and other organizations will create advances that will save lives. We have to work with urgency. We have to be willing to take chances and innovate. We have to measure the impact of what we do, and we have to work in partnership. I'm delighted to receive this award, and I can't tell you how important it is that all of you this evening care enough to come to an event like this. Thank you very much.
Thank you all for being here. I was born into global health. My mother was a physician. She worked exclusively in impoverished communities in South Africa, my homeland. And I remember going into the townships with her and seeing at first hand the suffering, the malnutrition, and just the plain hurt that diseases like TB caused in those communities. And I always remember her telling me to do something about this. She always said, end these diseases and the conditions that cause them. And I took those words seriously. We were living in apartheid South Africa, and so I threw myself into the anti-apartheid struggle. I organized communities, focusing mainly on health and education. I edited a newspaper to support these activities. I was in and out of prison all the time. And in 1976, when South Africa exploded, I was arrested. And after my release, I was banned and house arrested for 5 years. During that time as well, things got rough. And 3 of my close friends, Steve Biko, Neil Agate, and Story Mazwembe, were tortured to death by the security police. And I was forced into exile. I'd obtained, in the meantime, a PhD in biophysics and wanted to try to get some congruency in my life. I wanted to align my scientific and political views. I'd seen people suffering of diseases all through Africa, because when I went into exile, I was traveling up and down Africa, having no papers whatsoever. And I decided to work on malaria. And this took me to the Rockefeller University in New York, where I spent the next 15 years. The human genome was being sequenced at the time, and I was wondering what we could do with the information that was contained within it. And I think this was one of the seeds of the science that would become systems biology. And I was not the only person thinking this. Many others were as well. And a series of events occurred, and I came to Seattle in 1996, and together with Lee Hood and Rudy Ebersold, co-founded the Institute for Systems Biology in 2000. And it was a unique organization. But as we developed the science of systems biology, it became obvious that it could be applied to vaccine and drug development. And so for me personally, the circle was closing, and I felt I was getting back to my roots. I wanted to use systems biology to tackle global infectious diseases, and I decided to join Seattle BioMed. It was actually a no-brainer. First, it was one of the best institutes in the world studying global infectious diseases. And the main reason for that is that the scientists are absolutely outstanding. It's truly a dream team, and I was very, very excited at the possibility of leading them. These people are smart, they're dedicated, and they are committed to developing vaccines and drugs. Secondly, the scientific vision and the mission was completely congruent. That is, do outstanding basic research in global infectious diseases and then translate these findings into vaccines and drugs that can help people. Fourth, and this was extremely important to me, the extraordinary culture that Ken Stewart had fostered within the organization was something that I wanted to be part of, something I wanted to experience, and something that was quite unique. And so our expansion makes Seattle BioMed unique. It is the only organization worldwide that combines systems biology and global infectious disease research under one roof. And this has actually excited the community tremendously. For example, I'm pleased to tell you that Peter Doherty has just joined Seattle BioMed as an affiliate faculty member. Peter, as you probably know or may not know, won the Nobel Prize in 1996 for his work dealing with the mechanism by which the body defends itself against viruses. And Peter may be our first Nobel laureate, but I am convinced he won't be our last. So what is the true value of combining systems biology and infectious disease research? As John Aitchison mentioned earlier, systems biology and medicine are looked at in a holistic way by this new approach. One of the major advances of this new scientific method is that it has the capacity to predict the outcome of some medical intervention. And this is critically important when you talk about vaccines. It is our best hope for predicting whether a vaccine is going to work or not. And that information is absolutely critical in knowing whether to proceed with the vaccine trial or not. And this translates into a great many lives saved, I believe. It is also important in defining the type of immune response that is needed for this vaccine to become effective. And that is the second part of the puzzle. Is it going to work, and how can you make it better? I'd like to digress for just one moment to talk a little bit about Ken Stewart. It is true, Todd says that we've been friends for a long time. That is absolutely true. We started 20 years ago playing squash together. I'm a better squash player than him, I'm pleased to say. He's prettier than me. Ken founded, as you heard, the Seattle BioMed 35 years ago, and he had extraordinary vision and courage in doing so. From a strip mall in Issaquah, he has built basically one of the preeminent institutes for global infectious disease in the world. And that is absolutely remarkable. He basically defined and decided to establish a global health institute before this became fashionable and before people had actually crystallized this as an idea. So we know Ken as a person of vision, but what is less well known is that he discovered a phenomenally important biological phenomenon, something called RNA editing. So Ken is not just what you've seen tonight, a visionary and a leader, but he is also a formidable basic scientist as well. However, I'd like us to come back for a moment and consider the diseases that we're focusing on. Well, let's start with malaria. There are approximately 300 million cases of malaria every year. And this results in about 1 million children dying every year. In Africa, a child dies every 30 seconds because of malaria. So let me repeat that. A child dies every 30 seconds from malaria. As a parent, think about that. Imagine the horror of watching your child die, and then another child die, and then yet another one of your children die. And Tachi mentioned earlier the horror of losing a child. Can you imagine this repeatedly, losing kids as we go along? This is something that we cannot allow, and this is something that we will not allow. I'm asking you tonight to partner with us in fighting these scourges. The South African struggle was hard, and many died and many sacrificed, but finally we won. The struggle against global infectious diseases is much, much harder, and it's an insidious opponent. This is going to be a very long and hard struggle. It's going to have its ups and downs. We're going to have successes and we're going to have failures. And we need partners who are absolutely unafraid of a challenge. And those will be people like you. So join us in this fight. Join to enrich the lives of others and to enrich your lives as well. So that's what I'd like to say tonight.
We were joking earlier about just shaking hands or hugging, so that's why.
I got my hug.
Thank you very much, Alan, so much. And thank all of you for being here tonight. It really shows that you're already part of the effort to improve global health. Alan and I are proud to be part of the best global infectious disease research team in the world. In fact, we'd like to ask all of our colleagues at Seattle BioMed to please stand up so people can see those of whom are doing the work at the Institute every day. They will be sticking around at the end of the program if you want to get a little bit more technical detail on global infectious diseases and systems biology. You might think that I chose a career in global infectious diseases from traveling around the world and seeing all these infectious diseases. But in fact, the furthest that I had traveled from my home in Boston was Connecticut when I committed to global infectious disease research. I did spend a lot of time reading about it, often in dusty libraries, but it became very clear to me that this was a critically important problem and one that I wanted to do something about. This problem, the importance of this problem, was reconfirmed to me many times as I did visit underdeveloped areas and saw what I consider to be unimaginable and, in fact, unacceptable suffering, much as you've heard about this evening. The image of kids dying from malaria, often 3 or 4 to a bed, with an iron frame, flaking paint, and a hard yellowed mattress, is terrible. So this is something that we all have to do about. This is an image that I never want to see again. Seattle BioMed is working every day to develop the vaccines and drugs that are needed to prevent this suffering and dying. And I think you hear the statistics about the deaths. I think you have to remember, when you hear close to 1 million people dying of malaria, just think of the tremendous suffering of those who are not dying, who did not die, and that have malaria many, many times during their life and the impacts on their family. So these are terrible diseases and things that we can do something about. Seattle BioMed, as you're discovering, is at an inflection point. We've had several inflection points. We have expanded our size, and we've expanded our capabilities, our scientific capabilities. We're poised now to do more about these infectious diseases than we ever have been before. This is not a time to be timid. This is a time to put our foot on the accelerator, to move forward even more quickly. Seattle BioMed is a community endeavor. It would not exist without community support. Support from you people and support from the organizations and companies that you represent. This support allowed us to build our building. I call our building a research machine. It's a machine in which we do our research. It supported our ability to equip that building and have the laboratories where the research is done. Now, contrary to what you might think, support that comes from you does not replace support that comes from the larger funders like NIH, National Institutes of Health, and the Gates Foundation. In fact, it enables us to actually attract the large funds that are needed from these other larger funding organizations. And I should mention, as an aside, we did receive, I believe about 10 years ago, one of those handwritten checks signed by Bill Sr., who's sitting here, that enabled us to build a world-class malaria vaccine program that will deliver a malaria vaccine. There may be fits and starts, but it will deliver a vaccine. So just to give you an example of how some of the support that is generated at events like this. From an event that happened several years ago in 2005, we were able to fund a pilot project with $50,000. This project identified key events that the malaria parasite undergoes during its first infection when it comes from the mosquito and travels to the liver. Those initial findings led to grant support to the tune of $8 million from 3 different agencies to be able to carry that work forward. So the funding that comes from events like this isn't replacing things. It's actually stimulating funding from other organizations. So this is one of many pilot projects that we've been able to fund. Another pilot project had a technical innovation for a diagnostic technology that led to a multi-million-dollar NIH award, for example. This will lead to many diagnostics. So finally, I would like to relate a conversation that I had with Dean Allen, who you heard from earlier, a lawyer a loyal supporter extraordinaire. A few years ago, Dean interrupted me as I was thanking him for his generosity. To my surprise, he told me that he was the one that was grateful. I didn't believe it, but he told me that he was grateful. I was stunned. And he said he was grateful for the opportunity to invest in such an important endeavor that could accomplish so much. So I'd like to ask all of you to invest in the future of global health. Let's hit the accelerator together. Thank you.